Welcome to the AUANews Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Welcome to AUA News Inside Tract. I am Dr. Ray Tan, Division Chief of Urologic Oncology in the Department of Urology at UNC Chapel Hill and the Data Committee Chair for the AUA. Today, we're highlighting the launch of the Urology Care Foundation Bridge Award, supported by Dornier MedTech. And I'm excited to be joined by Dr. Emilie Johnson, my former senior resident at the University of Michigan, and one of the first recipients of the award. So exciting. Dr. Johnson, welcome.
Thank you so much.
So Dr. Johnson's a pediatric urologist at Ann and Robert H. Lurie Children's Hospital, Chicago, and associate professor of urology at Northwestern University. As mentioned, she did her medical training and residency at the University of Michigan before doing her fellowship at Boston Children's Hospital. And she's an exemplar NIH-funded surgeon scientist with over 100 peer-reviewed publications. And so really it's a great honor.
Well, thank you so much for talking with me today. It's an honor to be selected for this Bridge Award and a real pleasure to talk to you today, Dr. Tan.
Well, first, I'm just interested in your sort of reaction and hearing the news. It's always an amazing feeling to get a grant or to win an award, but to be the inaugural recipient, that has to be something else.
Yeah, I was a little bit surprised, to be very honest with you, but so appreciative when I found out about the award. I actually happened upon the opportunity. I was perusing the AUA website for something else, and I found out about it relatively last minute. So I know that, grants are one of those things that you definitely won't get if you don't apply. And when I was reading the requirements, I felt like my situation was really a perfect situation to apply. So I was, to be honest, a little bit surprised, but so appreciative when I found out.
And we'll get into your project in more detail in a little bit. But, your project implementation and evaluation of SAFE-NC, a safe, feasible, and equitable newborn circumcision program, seeks to improve access to high-quality neonatal circumcisions. But this really builds on some previous work that's been supported by the AUA and the Urology Care Foundation. Can you tell us more about that?
Sure, it'd be my pleasure. I was thinking back in preparation for this podcast, and I think I've been an AUA member for 2 decades now, which is crazy to think about, but I'm really appreciative of all of their support over the last, years of my career, particularly as an attending. A lot of the preparatory work for the current grant was also funded by the AUA. I was one of the research award winners, the Urology Care Foundation Research Award winners in 2019. And so some of the preliminary, large database studies were funded by the AUA. And I actually was during COVID, so I spent the beginning of the shutdown interviewing a bunch of neonatal circumcision care providers from around Chicago. That work, those qualitative interviews, and the papers that resulted from that were funded by the AUA. So I felt really supported over the years. And I was also one of the USmart mentors a few years back. So Dr. Linda Baker was my mentor, and I just through that felt like the AUA still believes in me. And it's really important because research can be a slog. So I am just really very grateful for the continued support.
Okay, well, great. So tell us, a little bit about your award. What are you planning to do with the Bridge Award?
Well, to give you a little context, the original project was funded a couple years back by the Agency for Healthcare Research and Quality, or AHRQ. And we were at the end of year 3 when there was a big shakeup in the administrative availabilities of AHRQ. And so we were basically in the middle of this project where we're looking to redesign and reimagine a little bit how neonatal circumcision care is provided when we had an unexpected gap in funding. So basically we were at least halfway through the project and expecting to get the notice of award for next year of our budget. And we have still not received that and do not know when we are going to receive it. And so this funding allows us, it's basically an infusion to allow this implementation science work to continue while we're waiting for the administrative adjustments that are happening. So we're really looking to continue the work that was started by a prior grant. And we took a model that was actually first implemented in multiple African countries that were looking to expand newborn circumcision and think about how we can apply that sort of standardized care model to a variety of settings in the United States.
Great. I mean, I think, it's really awesome to hear because I know there's a lot of, research that's so critical to what we are trying to achieve with the AUA and its mission. And, the AUA has a long history of supporting investigators. And it's been, not uncommon for people to have sort of these disruptions or interruptions in their funding. So maybe you could share a little bit about, what this bridge funding really has been able to do in terms of helping you maintain your research program.
Yeah. It's a really important question and a really important point in these sort of unprecedented times when it comes to federal and external funding. So in this project, we had done a lot of the foundational work where we had, met with various stakeholders. It's a project where we're enrolling patients from 3 different Chicago area hospitals. So we have a lot of different folks involved from the patient side, administrative side, clinician side, interviewed them all, come up with really key elements that we thought should be part of newborn circumcision care, regardless of the exact care setting. And we had figured out how those base elements would be adapted for each of the sites that are currently participating in the project. And then basically we're completing the final steps to where we're actually going to implement the new care model at each of the kind of test sites, if you will. And that's when we experience the funding gap. And so this award has allowed me to continue to be supported as a PI, as well as continue to support the research coordinator effort at the other sites. As you might imagine, if you're part of a research grant and you're receiving a subcontract to support some of your staff and there's no budget, then that staff member gets pulled off of the project. And so for a period of time, we did not have research coordinator support at 2 of the 3 sites. And now we're able to continue enrollment and finalize implementation for all of the sites. So it's really very exciting. And it was a really key point in the research project where we needed a little bit of extra help to be able to continue to move along.
How would have things unfolded if you didn't receive this funding?
The honest answer is I don't know. I think what would have happened is that we would have had to largely pause all study activities, particularly at the external sites, until we could either secure other funding or until at some point, we received a budget from ARC. But I don't think we would have been able to continue in particular, patient enrollment would not have been possible without this award.
And it can be really, really tough, I think, for research like yours that have a really strong community stakeholder engagement piece. So much of that is built upon trust. And when you have these sort of issues that come up that really prevent you from following through on what you said you're going to do, it can present a real challenge.
Yeah, I totally agree. And, fortunately, my co-investigators who are from urology, but also pediatrics and OB and family medicine, they've been really supportive and have done everything they can to continue to move the project along during some unexpected hurdles. But I think having received this award really just legitimizes those continued efforts that are kind of being done in good faith.
Great. One other thing I was hoping to touch on, and I really love your proposal because you are going from describing a problem that's been in existence to really trying to figure out how we can solve that problem. And I think it really is consistent with how we, on the Science and Quality Committee and Science Quality Program at the AU are really trying to move from, data measurement to really quality improvement. tell us more about that. And it looks like you're using a couple of, different approaches there that, our audience may not be as familiar with. So would love to hear more about what you're doing.
Yeah. Thank you so much for that question. This proposal incorporates a couple different methodologies, but a few that I think are interesting to highlight are user-centered design, along with some implementation science principles. I alluded to the user-centered design when I talked about, these multiple meetings that we have, talking to the different folks that are involved in newborn circumcision care. But to take that to the next step, the idea there is that, okay, you talk with all the different people who are involved, but then you really involve them during the development of whatever your intervention is going to be. So it's not just having one meeting, the study team going back and developing whatever it is, materials for patients and clinicians, new workflows, and never showing it back to those same people again. It really is a back and forth kind of iterative process. So as one example, I can show you, this is not the final version, but I can show you here. One of the things we developed was a little like pocket card for the residents and for others who might be learning how to do the examination and doing the counseling for newborn circumcision. One thing that was like very consistent that people wanted was an easy to access tool to do the exam to know, is this kid safe anatomically to have the circumcision or should we wait? And we were like, should it be something on the phone? Should it be a poster? And ultimately, this little card was like what the people that are doing this work want. Like me as a pediatric urologist, I don't need an anatomy card anymore, but people who are new, people who do these procedures a little less frequently, this is exactly what we wanted. So, there's one aspect where we're working on the content. What types of pictures do you want? How do you want the information? But just coming up with, it needs to be this big and to fit in my pocket for me to actually use it. It seems simple, but it makes no sense for a study team to spend 2 years developing something that no one is going to use. So that's just one small example of something we're kind of working on that adheres to those principles. And then next I mentioned implementation science. So that's a whole field that could be a whole podcast in and of itself. But that's really the science of understanding how healthcare changes like happen, like get it put into practice and then are able to be sustained and kind of adapted for different settings over time. So this project at its heart really is an implementation science project where we developed all of the different components of the intervention. And then the meat of what we're doing is the part that's funded by the Bridge Award, where we're able to actually make the changes in the hospital. First, make sure we're ready to do that, then actually make the change, and then evaluate both the patient's clinical outcomes as well as how well we made the change within each of the different study settings. I'll stop there because you can probably talk for a long time about that, but those are sort of the concepts that I think really get at the heart of what this project is about.
I mean, I do love your example that you share, because it's not, I think we as researchers and scientists, we go about and we think about all these new fancy ways we can do things, but when you actually get the insights from the people who are going to using it, it's always striking how sometimes the simplest solution is the solution that it's going to potentially work the best.
Yeah. And it was, I mean, for this project in particular, it was so interesting how, we purposefully selected like 3 very different hospitals, even though they're in the same city. And regardless of like what types of patients go there and who were the specialties doing the circumcisions, like that one thing was something that everybody universally like wanted and felt like it would really improve their care.
The other, really interesting aspects of your work are, I think, or at least 2 things that really stood out to me is the equity lens that you are sort of applying to the project, but also drawing from some global health elements too. Can you tell us more about some of the inspiration for that?
Yeah. I'll start with the first part of your question about equity and then move on to the global health part of the question. So this way back when, before the 2019 Urology Care Foundation Award, way back when I started as an attending pediatric urologist in Chicago, the reason why I even got into this line of research was that I had clinics where I would have like 5, 6 to 12-month-old boys who were coming in requesting a circumcision, or their parents were requesting a circumcision on their behalf, more specifically. And for some reason, they had not been able to access that care in the newborn period, which just seems very strange to me. These were not patients that had an anatomic difference in their penile development. These were largely not babies who were very sick, like in the NICU, or had a concern about a bleeding disorder, any of that, like no clear contraindication to a circumcision, but for some reason it hadn't happened. And so the initial work that sort of led to the 2019 award were some other large database studies and patient surveys to try to understand that problem. And very high level, what we found is that more often than not, these were patients with public insurance, and they were more likely Black or African American than we would expect based on, even circumcision rates nationally. And so there was something going on where there was a specific patient group that did not have access to desired newborn circumcision in the same way as some of our other patients. So although the current research award is not really focused on a certain demographic group in particular, the initial impetus for all of this work was an observed potential inequity in clinical care. And so it turns out that the solution really has nothing to do with examining people by their racial group or their insurance status specifically, but I think by systematically sort of understanding how this care is provided or not provided, and trying to come up with ways to streamline the care in a safe way, you do end up improving health equity as the final outcome. So that's where it all kind of came from, and where I'm hoping we will get back to. But we're really at a very practical part of this work when it comes to the project that is currently funded. For the second part of the question, you asked about the global health lens. And so there is actually a whole care model for newborn circumcision through the World Health Organization, the WHO, that while all of the elements don't necessarily directly apply to the United States context, we use that framework to kind of determine the elements that we would think through for hospitals in the United States. So it was like the initial framework for our intervention was modeled after the WHO framework, even though there are some very important parts of care that are different in many African countries compared with the US.
Great. I think that's I think that's really cool, and how you can, take things from other fields and apply them in new ways and really make a difference there.
Yeah, we were fortunate enough for the bigger funded award to have a consultant from that original project who advised us during the initial phases of this project, Mainza Durrell. She was wonderful in just sharing her experience with developing the WHO standards and implementing those. So she's on to a different part of her life. So it was sort of fun for her to think back and share her experience.
So I know you're in the midst of the work right now, and so I think still things to be learned and discovered. But what's next? What's going to be next after this?
Oh, after the Bridge Award, well, I'm hoping that either we'll be able to have the remainder of the funding from AHRQ to complete some of the aims that are out of the scope of the Bridge Award, or I think we've come up with so many other ideas for follow-up studies based on the current award, some of which were exactly what we thought would be the next step when we originally conceived with the study, and a bunch of tentacle offshoots that I think might be really fun to think about for other funding and research opportunities. So the traditional obvious next step is to expand this safe NC care model to other hospitals in the United States. That's what we said in the original grant. That's sort of what I think we will do. But with so many people being really desirous of better anatomy resources, we have a very creative and intelligent resident who has started to think about an app that may help with anatomy assessment. So that's one potential offshoot, and has started to work on that project. So there's a bunch of other things that we've learned from the experience doing this research and from talking with colleagues at a lot of other hospitals that might not be exactly what we thought we would do when we first conceived of the project, but I think really important other next steps as well.
Well, hopefully there'll be even more AUA mechanisms in Urology Care Foundation just to help propel this work forward.
Yeah, I'm hopeful, and I don't know exactly what the sort of federal funding will bring as far as whether the project will be completed in the exact way that we thought. But I've really taken a step back and realized how much we've learned, how much we've accomplished, what we're going to be able to say just by enrolling patients post-implementation. And we have a lot of really well-developed collaborations now as well. So I'm excited about the potential for the future.
Well, Emilie, I think it's been absolutely wonderful to have a chance to catch up and to hear more about your work and more about the impact that the Bridge Award has on you. Any other concluding sort of thoughts or sentiments you want to share?
I also want to thank you for taking your time to do this today. It's been a real pleasure to be involved in various aspects of the AUA, and I'm happy to be a new member on the data committee under your leadership. So I appreciate you joining me today and taking some time to figure out what I've been up to in the last few years. So, and I also want to again express my appreciation to Dornier for their support, to the Urology Care Foundation, to the AUA. I hope that it's come across, but like this is just a very important time in a lot of surgeon scientists' life, sort of figuring out if that model is sustainable. And it's wonderful that the AUA has made a very direct effort to maintain those of us who are in that world. So I'm very appreciative.
Yeah, no, I think we are seeing it here too over at UNC, and how some of the viability definitely has come up, in terms of what can we do to really support, people who want to pursue science as part of their urology career. So
Absolutely.
Well, Emilie, thank you so much for joining me and sharing your work. For those listening, to learn more about the Urology Care Foundation Bridge Award and Dr. Johnson's project, as well as the other recipients, Project Dr. Sunday, please visit auanet.org/Bridge Award winners.
This has been an AUAnews Inside Tract podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.